I want to welcome back our viewers to Conversations with John, where each conversation is an invitation to hear from leaders across the denomination. And today we're very happy and I'm very honored to have with us the Reverend Dr. Karen Lebacqz. Karen, why don't you say a few words about yourself? I know that for 30 years you were a bioethicist at the Pacific School of Religion, but say a few words to our viewers about who you are and what your focus is.
Well, I'm retired now for quite some time, but I did teach at Pacific School of Religion in the Graduate Theological Union for about 30 years. And after my retirement from there, I served as bioethicist in residence at Yale for a year. And that was during the time of Hurricane Katrina and also during the time when we had the avian flu pandemic. So I did a lot of thinking about pandemics and what justice requires during that time. And of course, I have also written long ago several books about justice, but not recently.
Well, this will make for a most interesting conversation. I was, in fact, curious about what got you interested in focusing on pandemic, and you've already given me some insight into that. Why don't we just get into the meat of this? I know that there are things that you need for the public at large and the church to hear about being the body of Christ and responding appropriately in a time of pandemic. So what are some things that you need for us to hear? What are some things that you would like us to know about, please?
Well, the first thing that I want to say should be obvious to everyone, and yet our leaders in Washington do not always seem to focus on this. This pandemic is bringing into sharp relief some of the injustices that are already widespread in our society. When we hear that African Americans, Black and brown people are dying of COVID-19 at rates that far exceed their percentage in the population, that should immediately be a signal to us that we are living in a time of systemic injustice. And therefore, it seems to me that any response to this pandemic can't just look at what justice might require in an ideal situation, but also has to raise questions about remedial justice and how we address this very difficult situation.
That is a fascinating point. I've been reading, as we all have, the data on how cities and states where the Black population is at 13% has 52% of the deaths, 30% with 70% of the deaths. You talk about remedial justice here rather than ideal justice. Describe for our viewers what some of the differences between ideal justice and remedial justice in a time of pandemic might look like.
Okay. Well, first of all, because my field is ethics, I'm not a physician, though I do try to follow the science as carefully as I can. But because my field is ethics, what I tend to focus on are the kinds of principles that I think should underlie our approach to this pandemic or to any pandemic. And speaking as a Christian and a representative to some extent of a Christian body, it seems to me that there are some principles that come out of my Christian conviction that don't always match up with the kinds of values that I see dominating in this society. What we've seen in the last week or so is lots of people saying, I have my rights, I want my freedom, I want to go back to work. I totally sympathize and understand why they are feeling frustrated, why they are scared and anxious, why they want to go back to work to support their families. But from a Christian perspective, it seems to me that there are at least 4 values that should underlie any response that we have. One of those is an understanding of the equal value of all people. A second, for me, of course, would be an option for the poor. A third would be that we try to save as many lives as possible, precisely because all lives are valuable. And a fourth value is the common good. This is a value that is spoken about frequently in Roman Catholic circles, maybe not quite as frequently in Protestant circles. But the idea there is that justice doesn't simply require that the society do something for me, but it requires me to ask what I owe to society. So I have to do things for the common good, even if I don't always like what that requires of me.
That's not what your country can do for you, but what you can do for your country.
Exactly. Where did that go?
Like a good Catholic upbringing.
It's gone. Could I also say, at the risk of preempting what you were going to ask me next, that I think we're in a very difficult situation here, and that justice might require a different approach depending on whether we are talking about testing, which is a kind of predictive approach, if you will, or treatment, which is what do we do once we have this virus, or the development of a vaccine, which would be a preventive measure. So justice might require different things depending on which of these sort of modalities we are talking about. And part of what makes this very difficult right now is we really don't have reliable testing. There are lots of questions being raised about the tests that we do have available. I confess it drives me crazy when I see people driving through a line and someone takes their temperature and then waves them through the line as though taking the temperature means you do or don't have this virus, when we are being told by the medical experts, you might have the virus without any symptoms. So that alone is driving me nuts. And now there are questions being raised about the different kinds of tests that we have. So that's a big issue right there. Treatment is also a big issue because we really have no reliable treatment at this point. You hear a lot about distribution of ventilators. You don't hear as much about the risks of being put on a ventilator and what ventilators do to your lungs in the long term, and the potential so-called side effects of ventilators, such as blood problems and amputation, which has gotten a little bit of press lately, but not as much as perhaps it should. And then there's the whole issue of the development of a vaccine. We are not safe to go back into the public arena in large numbers until we have a vaccine. And in order to get a vaccine, we should do carefully controlled trials. And that takes time, and nobody wants to spend the time. And that's part of what's making this so difficult right now.
So, I'm fascinated by the 4 principles that you've articulated. This may or may not be a fair question or one you're prepared to answer, but I'll risk asking it anyway. Are you seeing anything in response to the pandemic, either by our government or by the church that you have some representation for, that is consistent with those 4 principles? And the other part of that question would be, what are you seeing that you wish we would invest in differently because it is not consistent with those principles?
Yeah. Well, first I need to acknowledge at the outset that the problem with principles is, first, they are difficult to implement. And second, they don't always match up with each other. So, for example, one of the things that I am seeing is an emphasis on getting treatment to nurses, doctors, those who are on the front lines of taking care of patients. This is good because this is a way of ensuring that they will get treated and be able to continue saving lives. So if one of our values is trying to save the most lives possible, then giving treatment to those who can help do that seems to me to be a very valid principle. So I affirm that as one
Even
of the
though at
criteria.
times it may be in a conflict with the principle of helping the poor.
Absolutely. And this is where it gets difficult.
Sure.
One of the sort of time-honored ways that we have given healthcare is a kind of first come, first served principle.
Right.
Those who walk into the hospital first get treated first. Now, that's not true in ER rooms. In emergency rooms, there is a kind of triage system at work. Any of us who have been in an emergency room know that sometimes you have to wait for hours and hours because others are coming in who are much more ill than you are, or who have a gunshot wound or something that absolutely has to be taken care of so that they don't die if yours is not a life-threatening condition. So we already have a kind of triage going on in our medical system. But one of the difficulties with the first come, first served, or take those who come into the hospital first approach is the poor are never the first to come into a hospital.
Right.
They are never the first to seek care. They come into our emergency rooms often when they are very much more sick than those of us who have the option of going to a private physician. So the poor are not served by that kind of a principle or that kind of an operational approach to a principle. So there really is a difficulty for me, and I do think that we should treat first those who can save others. I think we should treat next those who have frontline jobs that are crucial during such a time, the firefighters, the police, and so on, the janitors. Determining what is an essential job is not easy, and I understand that, but they should get some priority. And then we probably should think about a principle of saving those who have the most chance of survival. I don't know if we can predict that with this virus, quite frankly, but sometimes you can predict that this person is not going to need a ventilator as long as someone else is. And maybe that means that that ventilator can then be made available for another patient or for more other patients. And that seems to me not a bad approach. But if we do that, that probably means that a lot of the poor who come in often with secondary conditions that make their health even worse, that make them not likely to be the ones who will survive. You know, most people who get put on a ventilator don't survive. I mean, ventilators are sort of like the last option for what you do in treatment. And they are hard on the body, and they are not a guarantee that people are going to survive. The statistics are not good about ventilators. So it's hard to know how we could put into place an option for the poor. But I do think that some of our cities and states are trying to address this problem by doing things like requesting federal money in order to get hotel rooms where you can put the homeless who otherwise are on the streets in crowded conditions. So there are things that can be done to try to improve the health status of the poorest of the poor. And the heartbreaking for me conditions right now are in detention centers and prisons, because there's no chance of social distancing, and our justice system does not allow a rapid response to what we really need to do for these people. It is heartbreaking.
It is indeed. And in addition to the system isn't prepared to deal internally and institutionally with a health crisis like this, the public has been conditioned to offer very little sympathy to that community. And
Yes.
and so when we hear the stories of what's going on there, it's almost as if people don't even care. And that's as heartbreaking as what's unfolding there.
Yes, it is. Now, if we ever get to the point where we develop a vaccine, and that's, I hate to say it, probably a long ways away, if we
Realistically, yes.
if we follow the recommended approach that requires clinical trials and different kinds of tests to make sure that we're doing it safely, it's probably a long ways away. But if we do get to the point of developing a vaccine, one of the things that we could do then is make the poor and those who must live in crowded conditions a priority for getting the vaccine. That will not happen, likely, in this society. Frankly, with our current government, I do not see the kind of sympathy for those who are in detention camps or in prisons or homeless on our streets. I don't see the kind of sympathy in our society as a whole that would let this happen, but maybe the church can be a voice for that.
I was just thinking the same thing, and I'm hoping that our viewers will take that to heart, and mobilize a collective voice in support of this. And certainly we in the United Church of Christ can make a concerted effort on this.
John, there's one last thing that I'd like to say, and that is that I am in one of the populations that is considered vulnerable. I'll be 75 shortly. And given that, I'm frustrated because I really am required to shelter at home and not go out, not even go grocery shopping. So I'm having to survive in some very strange ways that violate my sense of what I should be doing as a citizen. I want to be out there helping, and I'm told that the most helpful thing I can do is stay home, and I'm doing it, but I don't like it, to be very honest with you. But I am going to say that when it comes to the development and distribution of a vaccine, I would not make the elderly population a top priority, even though we are a vulnerable population. This will probably not please everybody. I love life. I love living. I do not want to die. I love my friends, many of whom are my age or even older. But we have had our chance to live. And I would give priority not only to those who have no option about social distancing, but I would give priority to those who take care of dependents. And that would include both dependent children. I'm way past the age of having dependent children. And it would include those who take care of dependent elderly people. I have the privilege of living in a senior community, but many of our poor people cannot put their parents into a senior community or a nursing home. They have no option but to take care of those parents. So this is one way that we could possibly give some priority to the poor, not making the elderly a priority for the vaccine, but making caregivers with dependents a priority for the vaccine.
Karen, you remind me of every good bioethicist I know who are aware that some of the things that you say may not be the most popular, but you feel a deep obligation to speak your wisdom and your truth to a public that needs to hear them. For that, I'm grateful.
Thank you.
I'm going to change gears completely before we go and just ask one frivolous question. I'm looking at that beautiful quilt behind you, and I wonder if there's a story behind that.
This is, I was supposed to have a small show of biblically inspired quilts, at the Claremont United Church of Christ. Earlier this year, it was to be a fundraiser for the church.
Yeah.
Of course, we had to cancel it because of COVID-19 and the stay-at-home orders. So this is one of the quilts that would have been in my biblically inspired show. I did not design this quilt. I don't want to take credit for that, but I did make it. And it's one of 8 or 9 quilts that I have made now, some of which I did design, that are biblically inspired or biblically related.
It is beautiful. I'm glad I asked. I want to thank our viewers for tuning in once again to Conversations with John. I want to thank Karen Lebacqz, our guest, our very thought-provoking guest today. And Karen, I'm going to give you the last word. Any final word you want to share with our viewers?
Well, I do want to say hello to all my wonderful friends and colleagues out there in the UCC. I think our denomination has a long history of speaking out for social justice. And I just encourage you to continue that tradition, and I thank you for doing so.
Thank you, Karen, and thank you to our viewers for tuning in. We'll be back shortly.